Good morning, chairperson and members of the committee. My name is Tiffany Whitmore, and I am an SWT social worker in training with First Alliance Healthcare. Currently, I'm completing my advanced training to become a therapist. In my work, I support youth and young adults who have experienced trauma, instability, and exploitation. Thank you for the opportunity to testify today on an issue that demands urgent and sustained attention: human sex trafficking in our state. Human sex trafficking is not a distant or hidden crime. It is happening here within schools, shelters, foster care systems, and especially in online spaces where minors can be contacted within minutes. Traffickers deliberately target vulnerability, homeless, prior abuse, lack of family support, and involvement in child protection systems. Despite increased awareness, many victims remain unidentified until the exploitation becomes severe and deeply traumatic. The scope is significant. The average age of entry into sex trafficking is 12 to 14 years old. Online recruitment continues to rise, especially for minors. Black, brown, and LGBTQ youth and system-involved youth are disproportionately impacted. These are not just statistics. They reflect children groomed through trust, manipulation, and psychological coercion long before exploitation is visible. Our current systems are not coordinated or proactive enough to identify tracking early, especially during the subtitle grooming stages where intervention can make all the difference in the world. Although our state has task force, mandatory reporting requirements, and specialized service, most responses remain crisis-driven. Prevention, early education, and long-term support, the interventions with the highest impact, remain inconsistently funded and unevenly implemented across the communities. To address these gaps, I am advocating for the comprehensive human sex trafficking prevention and survivor support initiative, grounded in evidence-based practices and informed by frontline experiences. These initiatives will include, number one, statewide prevention education for middle and high schools. Youth need developmentally appropriate education on grooming tactics, online recruitment, and safe help-seeking pathways. Number two, mandatory trauma-informed training for all youth-serving professionals. Teachers, healthcare workers, law enforcement, and child welfare staff must be equipped to recognize the early signs of exploitation. Number three, expansion of long-term survivor center services. Survivors need stable housing, trauma therapy, legal advocacy, job readiness support, and consistent case management, not limited short-term crisis care. Number four, stronger digital safety protections and platform accountability. Traffickers use social media, gaming platforms, and encrypted messaging to recruit minors. Strengthening reporting requirements and surveillance tools can significantly disrupt recruitment. Number five, a unified statewide data system. A centralized system would allow agencies to coordinate cases, track risk factors, identify victims earlier, and evaluate policy effectiveness. Adopting this initiative will increase early identification of grooming and exploitation, reduce youth homelessness and system involvement, improve long-term recovery outcomes for survivors, strengthen interagency collaboration, lower the long-term costs associated with crisis care, hospitalization, and justice system involvement. Most importantly, it will prevent harm before exploitation occurs, something our current system rarely achieves. Today, I respectfully request that the committee adopt and fund the comprehensive human sex trafficking prevention and Survivor Support Initiative provide long-term sustainable funding, not temporary grants, so prevention and survivor services can be available statewide. We cannot wait for youth to reach crisis before intervening. We have the knowledge, the tools, and the evidence. What we need now is the investment and commitment to act proactively. Thank you for your time and your dedication to protecting vulnerable children and supporting survivors. Strengthening our response to human sex trafficking is not only a policy priority, it is a moral responsibility. I appreciate the opportunity to speak and welcome any questions.